Sorry.
Okay, where's the
Sorry,
right ventricle?
Right? That's right.
Yes.
Right ventricle. And on the other side, where is it? Right ventricle. Where's the left ventricle? Right, so how do you know the difference?
The left
Left is bigger.
The left is bigger.
But especially the thickness of the muscle. So this is, in between this area is the interventricular septum.
Septum, yes.
So then, what are these structures called?
Is that
Cardion, tendon.
Chordae tendineae.
tendinate.
And what do they connect into here?
A muscle.
Papillary muscle. And what's on this side? What leads into the?
It's the bicuspid.
So this would be the
valves.
bicuspid valve. So
Yes.
these would be the cusps of it. Let's see if we see we see the cusps a little bit more here. So that's the cusp. So then what's up here?
And that's the left atrium.
Left atrium. Good. And this is a giant papillary muscle, right? Because if you see the chordae tendineae, piercing right into it, then that has to be the papillary muscle. Like that one's huge, but that's now. So this is what, since you cut it in half, it's hard to see the aorta because you kind of destroyed it.
This is the aorta.
Oh, that's what you cut it and maintained it all on one side. So that was pretty close.
Yeah, and this is the trunk, the pulmonary trunk. So I think this
So
one
where's
has
the aorta? Go through the aorta. Let's see. Go again. Right. So then you should see cusps of the.
the semi-lunar.
You still haven't. Oh, you don't have a scalpel anymore, huh?
We do. We fix it. We find a way. Right there.
So this is the aorta within here. So if we open it, we'll try to look, see what we can see as we open it. So as we open it, then you see these flaps are the cusps of what valve?
This is aortic.
Aortic valve. Right. So these are the cusps, and when the blood goes flowing out systole, the left ventricle contracts, it blows open the aortic valve, and the cusps of the aortic valve block the openings of the coronary arteries. So this would be one side, and you just see the openings, and it'll be the other side.
Okay.
Right? So the right and left coronary arteries, so that's why the coronary arteries, so that's one of the reasons why they don't fill during systole. When blood gets forced out, the valves are open and blood can't flow into the coronary arteries.
Okay.
Then the heart relaxes, blood comes gushing back, the valves close to prevent the backflow of blood. The arteries are open and blood enters. So blood enters the coronary artery during diastole. But this one's good. These are the cusps of the aortic valve. So actually you cut it in half, but it worked out perfect because you left all the aorta.
Contraction, that's when they close. Which is
During
systole.
contraction, the muscles are working, so the blood can't flow into it anyway, but the flaps cover the openings of the coronary arteries. So then when the heart relaxes, blood goes back, the valves close, and the arteries are open.
Open, okay.
So the coronary arteries fill during diastole.
Okay, so during the test, you're going to give us this, and then name this, name that.
Yeah, so this you don't need, this is a moderator band. It's only in the right ventricle, but you don't even need to find it. But it's a thick band that prevents, this is less muscular, so it needs a little bit of a help not to overstretch. So septum, left, right. So what valve is this then?
This is the tricuspid.
Tricuspid, right? It's the right side. It's the tricuspid.
Yeah. And then this looks like the superior vena cava. I'm
So
not
let's
sure.
see. Let's put the whole thing together and see what we find.
So,
Is this the way it was?
mm-hmm.
Yeah. So there's the right. What is this?
This is auricle.
Right, auricle. So yeah, the opening from above. So most likely, then this is the superior.
Maybe
Vena cava.
this hole right here, this one right
Yeah,
here.
it doesn't. Oh, yeah, that's definitely so right, straight from above. So then this is definitely superior vena cava, right, entering right into the right atrium, and then the horizontal one is usually the one. So it comes up this way. The chances are this is the
Yeah.
right going right into the right atrium also.
Yeah.
So this is the inferior vena cava. Good. That was the superior vena cava. And then, what's this over here? What chamber is this? So what structure is this first?
This structure is
Right,
the,
these ears, these appendages,
is-
these are the auricles.
Auricle,
Right, this is, which is
auricles.
this right or left? This is
This
Right.
is the
right,
right, and
so
this
this
is
one
the
is
left.
left.
Yes.
So what end, so the auricle leads in, the left auricle leads into the left atrium. What blood vessels lead into the left atrium?
It's pulmonary arteries, pulmonary veins.
Pulmonary veins that are
'cause they
coming
have
from
oxygen
where?
From the lungs.
From the lungs, and they're oxygenated.
Yeah.
Right, so most likely this is a pulmonary vein, and then we open it up and we see, yeah,
Yes,
it's going
yes.
into the left atrium. So this all worked perfect.
Okay. So we get the 10 points.
Right, so check that sheet, make sure anything that has a D on it, you should be able to find on this.
Okay.
On this.
Okay. All
Right,
right.
everything with a D, but I think we
Okay.
went through,
Yeah.
it was good.
Did we do this one? No.
Bronchial
The trunk?
cephalic
Yeah, on
trunk.
this, I don't think it, like sometimes it's there, it depends, because it might be cut completely.
Yeah, this was cut off
If
completely.
you just see the aorta,
And just
then
say the,
usually it's cut. Where'd we go with the aorta?
aorta is right here.
Yeah, if it's cut real low, then you just see the
So the
aorta.
The aorta comes through this way, and it leads through down
Yeah.
here.
So actually, well, let's see. Where does this go then? No, I think I would say the brachiocephalic got cut. It was usually half the time you see it, half the time you don't. But if it's close, very close,
Is the
You don't see it.
brachiocephalus on the right?
it's off of the aorta, right? It's the first one of the first branches off of the aorta. Where there's those three branches, the brachiocephalic is the first.
Okay.
So it's in the aorta, the beginning of the aortic arch.
Like use
But on the sheep's heart, a lot of times it's pretty close. So if you'd still see it, like it would be right here. So if there's another one where you see it, I'll point it out to you when I see it on one of the other ones.
Okay. Oh, we have to do more?
No, you got to keep going.